Good evening. Welcome to Nazareth Care's first live stream workshop. Tonight we'll be discussing a topic that has been part of our lives since March, which is the effects of Covid-19 lockdown and also caregiver burnout. Tonight with us, we will have in the workshop Hans Boerman, who is a GP and works in our specialist unit in the villa, Letitia Strauss, which is our occupational therapist, and myself, which is Melody Ziervogel. I specialize in dementia and also help with quality of life for Nazareth Care. So welcome. I would like to start off by just discussing what a caregiver is. We have two types of caregivers primarily. The first type is caregivers which are in specialist facilities like we have in the villa. And these caregivers look after loved ones that are residents in our care. We also get the second type of caregiver, which are community-based, and these are the large portion of the community and the most unrecognized. So tonight we would like to dedicate this workshop primarily to recognize the great work that community-based caregivers give. So caregivers in the community can be live-in caregivers. They can be caregivers that come in and out of a home daily and work specific shifts. Or they can be family members like a brother or a sister or a spouse, which take over the caring function of looking after their loved ones. Dr. Boerman, I'm going to go over to you. You can give us an outline of COVID-19 and the effects.
My sense has always been that public appreciation for frontline healthcare workers has been tremendous. There's been a lot of campaigns around that. Those of us that have identified with being frontline healthcare workers have felt that in a gratifying way, but it sometimes almost feels like we've been cheating, because we've actually had quite an interesting time in the lockdown, because we as healthcare workers have been able to travel freely, we've been able to go to work, we've interacted with colleagues, we've seen patients on a limited basis, but nonetheless have contact with outside people. We've been able to care for people, and then when at the end of the day we would be able to go home to our family and carry on life. It was different, but it wasn't nearly as stressful as we imagined that to have been, of people who live in their homes with a person they care for 24/7, 7 days a week, 30 days a month, and now 200 days plus. And there's not been much of a campaign. Those people don't identify themselves as frontline healthcare workers, so they haven't done that. They are, but in a general sense, they probably don't see themselves as receiving the praise of the public or the support of the public in the sense that we have. And really, we wanted to say that a lot of healthcare workers in institutions like ourselves have had a hard time, have experienced symptoms of burnout, have had sleepless nights, have had stress reactions, have had physical symptoms and mental health issues, chronic fatigue, whatever you can throw at us, it's all been manifesting around us. And we still think we got off lightly compared to those people that sit at home, have to make special arrangements for the food to come to them from outside without contaminating the home. Often the people that they care for have other comorbidities, so they're very vulnerable. People have lived in fear of contaminating their loved ones and of making them ill and losing them. And it's been very hard for those people, and we really wanted to spend a little bit of time mostly giving anecdotal accounts of our own experience and then picking up on what we think could be helpful to those individuals who do this amazing work without much recognition.
Thank you for that. I think it's very relevant.
It is. I think we've all experienced that in one more way.
Just to offer support. And would you also be able to help us with the definition and just explaining more about role confusion that happens about being a caregiver in the community?
How do you mean?
How a family member would get is faced with the difficulties of role confusion when looking after their loved one.
So often in patients with mental illness, the love for them and the relationship as a mother or a father or a daughter or a spouse has a certain role that we have to play, loving and caring and supporting and being there in difficult times for people that we love. Whereas in patients, especially some patients with dementia, we have to really be very good about boundaries and directives in order to get through the day, to deal with things like waking up at night and wanting to go out, with aggression, with confusion, with all sorts of difficulties that the nursing staff and the doctors can deal with for a few hours, apply a firm hand. They're not identifying it with being a spouse, so they can be kind, but have firm boundaries, and they have been taught how to do that. Some of the nurses are incredibly good at that. But if one is also that same person's husband or wife, can give rise to a lot of conflict.
I think it's difficult to transition from the role of being a spouse to being a caregiver, and I think there's often traveling across that, and it's very difficult when you identify yourself, am I the person's spouse or am I a caregiver? And like I said, it causes friction, and I think it can also lead to increased stress and ultimately burnout symptoms as well.
And we carry that conflict. If you live alone with a demented person, there's nobody who says, look, you're doing well, I know it's hard for you, I wish I could help you, but I can't. Nobody says that. There's nobody like that. And that's one of the other really difficult things with caring for somebody with mental illness, is that it's a one-way relationship often.
Yeah, and it's very
the gratification, the gratitude for doing what you do as a carer does not come back to you from the person you love so much and you want to care for. And in lockdown, when there are no children, no other people seeing your work, nobody coming in and giving you a break or recognizing you for what you are doing, you have to be incredibly resilient and self-sufficient emotionally to be able to withstand those long months of isolation.
Absolutely. Why I think people got burnout from all of this.
It's very heavily loaded, and they must feel so much guilt, and it leads to resentment, and we need a vent, which they don't have, but we would have.
I think in pre-lockdown, everybody could have some kind of event. They could go out for an hour or so, go walk in the park or go do some shopping, but now there's nothing, so they have to stay isolated and almost incarcerated in their homes, and I think it's led to a lot of stress and a lot of difficult situations. So let's talk a little bit about burnout. We're throwing this word around. I don't know if everybody understands what it is. Burnout is actually a state of emotional, mental and physical exhaustion that's often caused by exposure to prolonged stress and excessive stress. So people ask, is there a difference between stress and burnout? Yes, there is. So I often see it as when you are stressed, it's when you are experiencing symptoms of difficulty and stress. It's almost like you are driving a vehicle on a dangerous road and you're going very fast and you know you are at risk of making an accident, but you still feel that I'm in control, I can make this, and when you make that last turn and you realize I'm safe, things can go on again. Burnout is all of that, and then you have to crash eventually. You land up at the end of the bottom of the cliff and you realize it's over. That is what burnout is like. So burnout also reduces our productivity and it saps our energy, and it can spill over in all areas of your life.
But Letitia said
Yes.
burnout starts not as abruptly as an accident. Yeah. And some people will function with burnout. They will have burnout and they will still be in the role of carer.
Yes.
But their functional status will be very much suboptimal, or will be starting to become more and more suboptimal.
I think that's important, Doctor, you said stress is normally recognized. You will know when you are under stress. There are some symptoms, but burnout often is not recognized until it's at a very advanced stage. And I think that's a danger about it. there's no steps to prevent it or to mitigate it, because people do not realize they are reaching that state of burnout.
So perceive it as a new normal. So for them, there's no warning bells.
Yes, and I think that's quite dangerous. Also, interestingly, is that stress is often the result of too much. So too much pressure, too much deadlines, too much demands. And whereas burnout is almost as not enough. I'm not having enough gratification, not enough satisfaction, not enough support. So that's quite a big difference. So excessive stress feels like you are drowning, but in responsibilities. But burnout is more a sense of being dried up. So everything is just gone. There's nothing else.
It's like you've got no more to give.
Yes,
just gone.
Maybe at this point I just want to chip in there. I mean, some people will be ashamed of experiencing burnout because for some people it means they have failed in their duty till death do us part, or because I'm your mother, I will always be there for you. And the truth is that we all have limitations, and we have limitations to our capacity to serve others. And if that capacity isn't recharged, then we get to the end of it, and it's completely acceptable and it's completely normal. It is not a failure.
That's very important.
Yeah, I think that guilt, like you mentioned, guilt makes it's almost like a downward spiral. That people have symptoms of burnout, and they feel guilt on top of that, it just gets worse. It's a very difficult situation to be in. So maybe we can look a bit about what causes burnout. We have mentioned a few things already. Burnout can be caused by various factors. So one of them would be work-related. That means like people at a work situation feel like they have no control or little control at work, excessive deadlines, lack of recognition, or unclear job expectations. All those things can make you feel out of control, which could lead to burnout. Lifestyle causes, on the other hand, can also result in burnout. People who are working too much, not taking enough time off, lack of close and supportive relationships. It's very important for us as humans to have supportive relationships with friends or spouses or other support groups. And also not getting enough sleep can contribute to burnout. And some of us have personality traits that can also make us more susceptible to burnout. People who are perfectionistic or have OCD tendencies, nothing is ever good enough. So everybody's laughing because we all recognize that. People who have a pessimistic view of themselves, they're also more prone to burnout because they don't have the self-esteem and the motivation to make things better. Also, the need to be in control. Nobody's laughing this time. We all have a need to be in control sometime, and when that control is taken away from us, it could also lead to feelings of burnout. And obviously, high achieving types of personalities can have the same kind of emotional tendency to burnout. I don't know if you have anything else to add to what causes burnout, more specifically.
One thing that COVID taught everybody, every single practitioner in this world, every healthcare worker, is that being in control.
It's no longer it's
not an option.
It's just surviving.
There's a bit more than just surviving, but this idea of having control and understanding what we're dealing with and knowing what the right choices are, we've all had to learn from the beginning, from the ground up.
Also, just as we thought we had everything under control, the next day something new popped up and we had to learn to adjust to the new circumstances. And I think that was also quite difficult for everybody to adapt to that.
I also think another issue that we see is when, because of COVID and because of loss of income in families in the community as well, the need to work and make that income back up to support your loved one and your family, there's a lot of much more stress. So COVID has also brought a huge financial burden to those people in the community, and that makes them work more, so it's less sleep and it just compounds. So burnout is an absolute problem.
It definitely
we need to help with.
I think it's important you mentioned the income. There's also been people who had reduction in income and they had to either let go of the caregivers they were employing, or they had to take their loved ones out of facilities due to financial strain, and that they ended up at home caring for their loved ones, and that caused a lot of strain as well. People don't always realize the emotional and psychological impact it has, I think, to look after someone at home, someone with dementia or mental illness. It really takes a special person to be able to handle all that kind of stresses.
We all want to be special people, don't we?
Yes.
And yet, it's It's not like that. It's not as simple as that.
It's not. Hey, life is complicated. So just picking up a few symptoms of burnout. How do I know I'm getting to burnout or already on the way to burnout? So if you get to work on some days and some days don't feel like a good day, that's just normal stress. We all have bad days and good days. But when it gets to a point that every day starts to feel like a bad day, you should be having warning signs that something is happening. Also, when normal tasks like caring for work and for your family and your daily activities starts to feel like a very big load on you and a burden, and you just feel like you no longer care about that, that should also bring warning signs that you might be heading towards burnout. Being exhausted all the time, that could also be a sign that you are starting to head towards a difficult situation. And if you feel that all the things you're doing every day is mind-numbing or just overwhelming and you just don't have involvement, no interaction or no interest in them anymore, you should also be looking out for your health because you could be heading towards that. And also, I think what Doctor also mentioned, if you feel like nothing you do is appreciated any longer, you don't feel worth anything, you just feel like nobody likes me, nobody needs me, nobody will know if I'm not here anymore. Those kind of things are very important signs for us to start to take a stop and a look and see where am I as a caregiver or a healthcare worker in terms of my health, my burnout. So feeling tired, frequent headaches, muscle pains, all those sort of things can also be indicative of that. And also if there's a change in your sleeping habits or your eating habits, that should also be a sign for you. So
I think what's important there is you must realize that it's okay to put your hand up and say, I'm not okay, and speak up.
I think that's a very important point because these days people feel like Doctor said, you have to be brave, you have to face this. And
so where do you put your hand up if you live in an area where there are no social services?
That's a very difficult situation to be in.
It is. That's why it's important that we reach out, and we've got to do everything we can and just be there for the community and focus on events and things like Mental Health Awareness Month and just get the news out there that it's okay. Just to link and form bonds in the community. It's very important.
I think another sign that one can look out for as a caregiver especially is when you start realizing you are harboring feelings of resentment or even hate or dislike in your loved one, which is completely abnormal, that should be warning bells to you that something is happening. If you, one day at a time, like I said, if something is not going as you planned, but if it starts happening on a regular basis and you start realizing that I'm harboring these very negative feelings towards my loved one, you should have a look and get some help because that is a clear sign that you are heading toward a serious case of burnout or crashing.
Look, maybe I want to just differentiate there a little bit. Not everybody who feels resentment and anger towards the person they are caring for is necessarily having burnout, because some patients
make it difficult.
are almost impossible to look after as an individual at home on a one-on-one basis. That's why institutions exist. That's why care homes exist, because there is a limit to what a single person can do. And when it's beginning to threaten your life, your well-being in your life, it may be a healthy sign if you feel resentful. Maybe a sign of knowing your boundaries and your limits and responding to that. Anger is a legitimate feeling in caring, even for somebody you love. We know good relationships involve a little fight or two every now and again. It's a sign of some capacity to recognize and to negotiate. The problem is with caring for mentally I'm struggling with the word now, but certainly unwell patients, is that often that negotiation doesn't happen. It's difficult. They're not able to engage in that sort of way. So who do you negotiate with? And that's when anger is almost inevitable. So anger, yes, when you start feeling inexplicable anger in yourself all the time.
I mean, there's no definite triggers if it's on a recurring basis without any explanation.
But if every time you fall asleep, the person you care for wants to go out and have a haircut at 2 o'clock in the morning.
That is more understandable.
Then, to be angry, I mean, that's a sign of good mental health.
That's very true. No, that's true.
What you do about it, I wish we had the answer to that.
Yeah, I don't know, Melody, do you want to talk a little bit about specifically how COVID has affected burnout? Or how COVID and burnout has a relationship together that we never had pre-pandemic?
Okay, well, one of the things we've noticed in our specialist dementia unit is if you have a caregiver and you are looking after somebody, you form such a close bond with that person. So COVID almost doesn't allow bonds, so everything we've learned about looking after someone with dementia, which is getting close to them, physical touch, sensory input, because someone with dementia loses that ability. So we are their sensory input, which is touch, which is making them feel like they're okay, physical contact. So it's been very challenging for us to do that, but do it safely under the COVID umbrella. So that we found is very challenging.
I think our residents especially found it difficult because they don't have the insight. We couldn't explain to them or reason with them. So just suddenly they were also a bit detached and isolated, no more holding on at hands, and I think that was difficult for them.
Yes, it must be extremely difficult. Well, it is extremely difficult for them on a good day. Then COVID happened and suddenly no more physical contact, and it makes you question yourself. What did I do wrong to that person? Does she not like me? And it puts up more higher walls and just more barriers, and it makes communication and getting to that person even much more difficult. So you have to work twice as hard to get that trust relationship back because it's just broken.
Totally. And they often, the only sense of security or consistency in their lives is the caregiver. And they had a routine and a structure, and post-COVID, everything was working all right. And now after COVID, everything changed, and they don't understand why. So I think it was very stressful. And that stress and that difficulty obviously reflects back onto the carer, which could lead again to the negative feelings and the stress and the burnout that we are talking about right now.
Yeah. And another thing that we've overcome, and that's also stressful and puts up barriers, is it's just small things like increase in hand sanitation, like what is it for? What are you putting that stuff on my hands for every few minutes? And it makes them feel isolated, like is there something wrong with me? Do I have germs? Like getting that message across. And also things like masks and wearing of visors that they would just not understand. So it's seen as a barrier, especially those people with dementia that cannot hear properly, and it's a struggle with communication. You have to try new communication techniques because they cannot hear you properly. So you maybe have to stand away, take your mask off and say, it's me, it's Melody, it's okay, you're fine, this is not about you, and just keep explaining just to reassure them and make them feel okay because they get very anxious.
Yes.
And visors, the plastic is reflective, so they struggle to see, and it's just an increased communication barrier. So what happens to them is they tend to just retract more and more into their shell and become depressed, and it just circumvents into other problems that you don't want.
What I've also noticed is to those residents especially who have limited communication and especially receptive communication skills, so they didn't really rely on words but more on our facial cues, and when we walked into the room and we smiled at them, at least they could identify that it's a good thing and they would smile back. Now I still smile, my biggest smile at them, but they can't see it, and
Exactly.
it's a difficult situation for all of us.
Absolutely.
Yes, some days I think we don't know how to communicate with them properly anymore with these masks, but we try and be getting there.
So a few good tips that we can give advice on how to communicate to somebody with dementia is that somebody with cognitive impairment is always going to give you the shortest answer back. So if we pose a question to them like, do you want to take a shower or something like that, they're going to immediately answer no because they want the conversation over and they don't want to have to just concentrate on what they're going to answer. So you never pose to them yes or no answers. You're just going to take the initiative for them and say, we're going to go on a walk today, and you try to use the empowering method instead of asking questions. They're not going to know what day is it today. They're going to sit there and they're going to feel like they have to write a test and they're going to panic and it's going to be anxiety. So instead, we try other techniques. We walk in, we go, hello, it's me, it's Melody, and I'm going to point to my name that's on my shirt, and I'm going to say, it's Wednesday today, it's a nice sunny day outside. That way, you're orientating them anyway. You're not making them feel the pressure of, oh gosh, what do I have to do now? And you're just setting them up for a good day. You're making them feel calm. And if someone is angry or feels some emotion, they're not going to understand why, but they're going to walk around the whole day with that anger and just stress the whole day, and you don't want that because it leads to other things and difficulty in eating and all of that, so it just compounds. Then also, we never argue with someone with dementia, so if they tell you, I'm very sorry, I'm not that person today. Today I'm 24 years old and I'm waiting for my husband at the gate. Then if they're 24 years old and they're waiting for their husband at the gate.
So obviously do not strengthen the delusion, but you find a way to work around it and just ignore it. And don't try to change their minds.
No, absolutely, because in their reality and in their world, that's where they're at. And that's how we care for them in that space and just make them feel safe.
I think they're pretty much like teenagers at this stage. No matter what you say to them, anybody's not going to be right. You're not going to change their minds. So just find different ways of dealing with them.
And some basic tips for those caregivers at home who are struggling, just on the phone calls that I get, most of it is dressing time and washing time at home and that frustration. So just a few simple tips is, always empower your loved ones, still give them that decision-making process, but just limit it and shrink it. So don't stand someone, for example, in front of a cupboard and say, okay, we're going to get dressed, what would you like to wear? They're going to stand in front of that cupboard and panic, and inside they're going, what must I do, what must I do? So 9 times out of 10, they will just start unpacking the cupboard because they don't know what to do. Instead, open the cupboard and say, would you like to wear this red shirt or blue shirt? So you're still giving them choice, but you've limited their options. And then you can tell if they still don't know then what to choose. You can make that choice for them.
I see you like the red one.
That's right, yes. That's why you're empowering them. They feel more relaxed. And also you're involving them in the process.
Yes.
And when it comes to water and not wanting to wash, people must remember, especially in advanced Alzheimer's, that it becomes very difficult for people to visualize water, and people just tend to do and not explain. So a good tip is maybe to just try and explain as much as you can. We're going to go wash now, and remember you have 24 hours in a day. You don't have to wash the person every day at the same time.
I think that's can I chip in something about the villa that I find very refreshing and encouraging, is that even though we are an institution who look after dementia residents, there's a lot of freedom. So we treat it as their home, not an institution. So
yes, we work in their home.
Yes, so if they want to sleep until 10 o'clock, if they only want to shower at 3, so be it. Like Melody said, there's 24 hours in a day. There's no need you have to bath and eat now, because I think that increases their anxiety.
Absolutely.
There's no shift changeover at 7, and you have to have washed all your patients by 7, so you start at 4:30 and wake them up.
Exactly. I wouldn't like being woken up after 4 to be bathed. I mean, Doctor, in your practice, how have you experienced communication with patients with dementia? Have you found any tricks or ways to overcome the difficulties?
Look, certainly during COVID, we haven't really seen patients at our rooms with any mental. Most of the elderly people we have communicated with through their carers or via Skype messaging with their care team, or we have come and done home visits. We haven't really had people like that into our surgery, because we do see other people there, and it's always a slight risk.
Yes.
We wanted to keep the risks very low. Communication, it's, there are so many tips and things that one can learn, but I think if you start with respect for the other person, and if you believe that they still have a will, they have feelings, and they have preferences, and they have fears, and they have things that they dislike, taking blood from them is not going to be easy. They're often defensive, but not always. And if you start like that, and it takes years, it's not something that we come out of medical school or from a geriatric course or something and suddenly know how to communicate with people with dementia. Every person is new and everyone is different. It's a relationship thing, and it has to start on the basics of basic relationship, mutual respect, getting to know each other, making mistakes, apologizing, trying again, reflecting on one's encounters with these people, and then trying a little bit more the next time we encounter them, and keeping good notes so we get to know, keep our sort of data on what we know about them, what we glean from them in a sort of very indirect way, so that we come there when we see them again 2 months later or 3 months later with some history that we can refer back to.
Yeah, can I use an example that you told me about actually? So at the villa, we respect the residents and we often pop into their rooms to speak to the carers, and we have the habit of saying, "Good morning, Mrs. So-and-so," even if she cannot respond back, we just acknowledge them as their rooms, and we do that. So Melody told me the other day, obviously no names mentioned, but one of our residents had a health practitioner visiting in the room, was for some procedure. And Melody was in the room with the person, and the practitioner just walked in and started business, doing whatever, because this resident is very aphasic, doesn't really speak, doesn't seem to have lots of understanding or insight. And as Melody was standing there, the resident looked at her at some point and said, "And she doesn't even introduce herself to me." So this is said to Melody, and I think that must have been very embarrassing for the practitioner, because this person just walked in and just carried on as if this person was not there. So I think what Dr. said, respect, is a vital thing. Even though this person has dementia, they are still the person inside, and they still have some kind of understanding. So we must always respect that and always acknowledge that in the person.
I quite like looking after. I mean, the challenge of looking after people with dementia, and the elderly, because partly I think over time one begins to identify with some of the things that one sees there. In these people. I certainly, if I've had a stressful week, I can identify with many aspects of the patients that I see at the villa on a good day, because I can get frustrated, I can get angry, I wish I could run away, all those things that we see probably in a more concrete way. We are still, in our way, able to contain them, but I'm certainly conscious of some of those things that I see manifesting there. Even this sort of unintelligible vocal expression that sometimes comes forth. It's not without intonation, it's not without feeling. It often, you can hear the feeling behind it, even though you can't hear what the words mean. You can feel excitement or anger or fear or those kind of things. And I think it's a very humanizing form. The moment you open yourself up to it and aren't horrified by it anymore and aren't sort of shrinking away from it anymore, it becomes it's a privilege, and we learn about the patients and we learn about ourselves. In our reactions, where we sometimes fail our patients, we learn even more about ourselves, because it is our own material that then comes out and interferes with a good relationship, not infrequent.
And another thing I've learned as well is they are just like young children and babies. They pick up on your vibe. So if you're having a really stressful moment and you know you need to go into a room, rather take a lap around the building, offload yourself before you go in, because they immediately pick up
negative
this person is sending off bad vibes, because all they have is sensory, and they can just pick up on you, and immediately you're not going to get your output that you want from that visit, so it's just pointless. So it's very important to be consistent with them, and also just to help them relax, because the more anxiety they have, the worse it is for them. So it's very important to check yourself before you approach anyone with dementia and talk to them.
So let's get back to a bit of burnout. We spoke about the symptoms and the manifestation thereof and the causes. What about treatment? How do we treat this condition? I don't know, Doctor, do you want to maybe go into if there's any medical or health perspective treatment guidelines or advice that you can give us?
I used to have a little New York Times comic on my wall at the surgery, and there was a guy who stood and said to the doctor, "Every time I bang my head against the wall, it hurts. What do you think I should do?" And the doctor's speech bubble says, "You know what, I think maybe you could stop banging your head against the wall." So the treatment of burnout in an ideal world is relief from the burdens of your life, temporarily, or a reduction in the burden of your life. So the first step is always, how can I moderate this burden that I'm carrying? And it is, unfortunately, like everywhere in the world, in this country, very much an economic thing. So people who have the privilege of being able to afford institutions and long-term care facilities, when they burn out, this is a time for, if nothing else, just a 3-week reprieve where you get a temporary admission to a care facility and you take a break and you take a deep breath and catch up on your problems and catch up on your regeneration. But it's not always easy, and I don't have simple answers for that. It's a very individual thing. One would have to look at the individual situation. There are no general sort of tips that I can give. I think medication for burnout is not that simple, because yes, if there's insomnia, if there's sleep disturbance, if there are overt manifestations of stress and agitation, then there are psychoactive substances, there are antidepressants, there are tranquilizing medications that one can use.
But that's only for treating the symptoms, not the cause, as you said.
Yeah. I mean, we know that the studies on burnout treatment of pharmacotherapy are showing that it's sometimes useful, but it's not always sufficient.
It's more important that we look at behavioural intervention.
So in the ideal world, we'd have good social services and people who recognize that they are no longer coping can approach social services for help. That would be the ideal world. I don't know what you, as in your experience, find that you can offer people with
We're going to talk about a lot of behavioural intervention. I'm not sure if you want to take a break at this stage. Are we taking a short break? And then when we come back, we're going to talk a bit more about other interventions other than pharmaceutical and medication. What can we do to almost prevent and treat the symptoms of burnout and to try to mitigate the effects thereof? Yes. Okay. We'll see you soon.
Should we stretch our legs? Let's get up. Have a rest here. Just see if there's some more COVID results for these ancient flatters.
My name is Sister Anne Margaret Craig. I'm the Regional Superior of the African region of Nazareth Care, and I am a 20k champion. As a teenager, I attended a large comprehensive school on the outskirts of Bristol.
Only 16 people watching.
16. What? 6.
My name is Sister Anne Margaret Craig. My name is Sister Anne Margaret Craig. I'm the Regional Superior of the African region of Nazareth Care, and I am a 20K champion. As a teenager, I attended a large comprehensive school on the outskirts of Bristol, and there we were encouraged to participate in some kind of voluntary work in the local community. So a couple of friends and myself started volunteering up at a children's home, and there again, I really got the sense that we could really make a difference to these children, no matter how much love and care they were receiving in the home, just to try and give them that little bit extra and to help them to know that they really are special and they're loved and cared for. I think this was the first time that I really felt that call to reach out and to help those who really were not as fortunate as myself. You know, I had a wonderful, loving family growing up, very happy childhood, and no matter how much love and care these children received in the orphanage, you knew it was just too many children to be able to give them that individual attention that they really needed. So I think that was the beginning of my call, really, to try and really make a difference in the lives of others. And that's what it means to be a 20K champion, to act on that inherent call that we all feel at some time, to reach out and to help those who are less fortunate than ourselves. For over 135 years, Nazareth Care has provided a safe space for vulnerable children. Through our 20K campaign, we hope to be able to continue in funding all our childcare, elderly care, and outreach program expenses. I am a 20K champion and I'm asking you to join me. Please take a few minutes to visit the Nazareth Care website and donate now. Your donation will make all the difference. It's the most you can do. Thank you.
So before the break, we had a brief we talked about treatment for burnout, and we spoke about a few things. I think Melody is going to continue a bit with other intervention, more behavioural modification, other ways that we can treat burnout or try to mitigate or prevent it. Melody.
So we're going to speak about treating burnout with regards to the people that you're caring for.
Yes, and the caregivers, like especially the community-based caregivers caring for loved ones.
Okay, well, what's good is you've got to learn how to recognize that you actually have burnout, like we mentioned before. Looking at your own signs and symptoms and knowing that I'm not okay. So that's the first step, is to try to help prevent burnout. Then we've got to look at what can we do to prevent this and stop it. So we want to try and reverse it, okay? And the best way to try and reverse it is to seek for help and support. And a lot of things we can do is that's where we would come in Nazareth Care, that we could help communities. We are affiliated with other associations as well. So even though, for example, if we look at finances and you are worried about finances, because we all know that during COVID people are struggling out there, we have support structures. Just reaching out is good enough. We can link people to other people to help. So it's always good just to put your hand up. And then resilience. There's a lot of stress management techniques that we can teach. We offer great support groups, support workshops that can just help those people just to realize that they're not alone and that they can get help. And I think that's one of the most important things, is just where to find help. The minute people feel that they're not alone and there is someone that cares for them, that's half the battle won.
That's very true. So, so I think, like I said, seeking out for help is very important, and finding a community or just somewhere where you feel that you belong, and you can have some time to release all your negative emotions, and almost like a vent about things that are stressing you is quite important.
Yes, and I think it's best if you're in that negative space and just to try and avoid as much negative as possible. So rather gravitate towards positive, even if it means changing your support system or trying to make new friends. Trying to introduce anything more positive is going to help, because if you stay in that negative bubble, it just constantly
makes it more difficult to get out of there. And I think what's difficult for community caregivers is, the next point, is finding a balance in your life. So instead of just letting your whole life revolve around caring for this loved one, you need to find an outlet somewhere. Either it's getting away to go do a hobby or to go visit a friend just to get out. And that was very difficult during COVID, during the pandemic. What were their options? You couldn't really go out, couldn't get someone else in to come and look after your loved one while you go out. So I think that was a real challenge for the people in the community.
Absolutely. And you sometimes see that in treatment and that as well. You start relying more on, this is how I see it, on pharmaceutical medication and then to help yourself, which also, you know that you can't really take much heavy things or sedation or sleeping tablets because your loved one at home is going to be up all night. So there's that kind of barrier, and then the other kind of barrier to try and help the person, the caregiver at home, is to help the loved one sleep better at night, but all of that medication is also not great. So you've got to find that sweet spot to help with quality of life and to help that person.
Oh, and that's a challenging thing to do. So sleep, like you mentioned, is very important. If you feel like you are on burnout state, then I think it's important to act after your own rest and your own sleep and make sure that you at least are healthy. I think what people don't realize is you cannot look after someone with the necessary care and commitment if you are not okay, if you are tired, if you are sick. So people often feel guilty. They say, I can't leave my husband at home because what if he wants me, what if he thinks I don't love him anymore. But if you don't give yourself that time to get away now and again, you are going to burn out yourself, and then you will not be able to look after him anymore. So those guilt feelings need to be reversed and say, I really need this break, I really need to look after myself.
Yes, absolutely. Yes.
It's not a luxury. It's a life support.
It's a necessity, definitely. So you need to get out of there. I think other things that we can look at is exercise. If it's possible, exercise is a great way for us to relieve our stress and just to reboot ourselves on again. So it doesn't have to be a vigorous activity, just go walk in the park, walk on the beach, just some kind of physical activity for us is on a regular basis would also help to help to prevent the onset of burnout if we look after ourselves properly. But you're also a runner, you like to exercise, so...
Oh, no, I was once.
You were...
No, it's a form of stress relief.
Definitely.
It's a form of stress relief. So getting outside and getting away from everything is very useful. But it's a luxury. It's a luxury.
And I also think another focus point or helpful tip is when you're doing something like caregiving, it can be very routine and mundane, and you think there's no purpose in what you're doing.
Yes.
So you sometimes need someone else to tell you, hey, what you're doing is actually a good job, and maybe approach it from a different angle and try and introduce new ways to make that mundane job fun.
Switch it up a
Because
little bit.
you'll never see that because you're stuck in this box. So you just need someone to help and support you to take the blinkers off.
I think this routine can be deadly, so it's
Absolutely.
safe to be in a routine, but now and again you need to change it up just to feel like you're alive, not just in the rat race doing the same thing over and over again. Maybe talk about a bit of diet. Doctor, do you want to jump in there? What is advice for a healthy diet, which can also contribute to wellness and mitigating burnout symptoms?
Sure, it's a difficult one. I don't know of any carrot or cabbage combination that we use.
I'm not talking about recipes or diets, I'm talking about guidelines. What we spoke about is maybe look at minimizing your sugar and your refined carbs. No, doctor wasn't paid to do any diet prompting it.
No recipes.
No recipes, don't know, unless you know one that works.
Yeah.
But obviously, I think the basics apply here. Look at avoiding refined foods and sugars and looking for freshness, healthy.
But you see, when you're alone and you are stressed, often food is
It's
a
a
way of
comfort.
rewarding yourself. I mean, if nobody is out there saying you're doing really well,
Then
a
you
bar of
reward yourself
chocolates
with a
makes you
chocolate,
feel
yeah.
almost as good. And that could be...
That's just like exacerbating the
And then you're going to have a mentally challenged person and
possibly.
a carer with comorbidities in no
Yes.
time at all. So you look,
So you should just-
everything in good measure, maybe, and a mixture of kindness and discipline. You know, you have to be kind to yourself every now and again, and you have to apply some discipline and say, look, not every night. If this is what I enjoy, then every now and again I have a way of rewarding myself with a treat of the food and consumption. It's kind. But if you overdo it, you're going to get into trouble.
Wouldn't it be nice if we could just be comforted by carrots? Make life so much easier.
Beetroot, carrots, I don't know.
Instead of chocolate and cupcakes and that kind of thing.
Yeah.
And I think also mentioned we need to mention alcohol. I think some people at home might reach for alcohol or other substances to kind of deal with their stress. And like Dr. said, in moderation, if you overdo it, you're going to sit with other problems. So then also your duty as a caregiver will be compromised. So it's important to look at those things as well.
But when your alcohol intake starts increasing dramatically, it might well be another sign of decompensation and burnout. So when early on we were looking for signs of burnout, when you start
noticing.
sort of using desperate measures, then maybe it's time to look up and say, I wonder what this is all about.
It's also useful to have someone else in your life, because often people who are living alone with their loved one will not admit to themselves. So it's good when another family member will come in and say, but sure, I noticed these changes in your life, maybe you should look for some changes.
Yeah, absolutely.
Any other advice on burnout treatment or management?
I would just like to say maybe sometimes what helps being in the community is if you feel that you're stuck and your loved one is displaying a certain behavior that you don't understand, and you start questioning yourself as what am I doing wrong? Sometimes good to keep a journal and track behavior, track doesn't have to be a formal thing. You can start off slowly and just say, you know what, when I did this, this is how my loved one reacted, and then you monitor it for a few days. And if you see a certain pattern evolving, it's not up to you to solve that pattern, but there are people to help you that you can reach out to that can have a look at your pattern and help you with practical tips just to make your life easier at home. So I also think that people at home mustn't feel trapped and mustn't feel like there is no hope and it's me that's causing this and what's happening, because the more stressed I'm going to get, the more stressed that person's going to feel and the behavior is just going to compound. So sometimes helpful just to get practical and regroup and start with small building blocks and just realize, okay, these few things are happening, what can we do about it? And that can actually maybe improve the situation dramatically, but no one's going to help you if no one knows about what's happening.
I think what became prevalent since the pandemic began was people moving on to digital platforms and social media, and I've noticed quite a few support groups on Facebook and those places, and I think that's also something that people in the community can reach out for, because that's a space where you can engage with others in your situation in a digital form, so that you don't have to go out to them, and that's where often people asking questions and giving examples, say, this is my situation, has anyone experienced this, can you help me? So just also to feel part of the community and feel like someone is listening out there.
You know what, maybe at this point I want to just ask you too about it, because I think there are often situations where a spouse is looking after their partner and they might be having a really hard time and making huge compromises in their life, but they're not really able to understand, to believe. It's difficult to believe that anybody else, like in a long-term care institution, would look after the spouse anywhere nearly as well as they do. So they would feel they would be abandoning their loved one to the care of a home or a facility, even if it was for a short time. And I think it's difficult, it's obviously difficult when you're in a relationship with somebody you love them dearly, for you to make the choice to let somebody else look after them, away from your home, out of your control. How do you begin to trust that they will be anywhere benefiting from that, or having value out of that, or not feeling abandoned? I mean, we all know that most people that come to places like Villa or these dementia homes, the first 3 to 4 weeks are really hard. And it's a huge adjustment. It's very difficult for the
resident and the
family. And yet, when I look back on the number of people that we've had, because the Villa is a relatively new institution, so everybody was brand new. Within 6 months, we must have had 20 new people into the home. Is that right? I don't know. But a lot of them really had a hard time, and yet some of them are completely settled in, happy. Unfortunately now lockdown intervened, but when their family could visit, it would work. They would see their family, and yet they would still have the carers, and the luxury of having a consistent carer, which I cannot overemphasize how much of a luxury that is. Of course, it's not always affordable, but if care homes can give consistent staff to individual patients, that is a huge bonus. That's amazing. So the relationship transfers in a way onto a care. Now, that doesn't mean that the relationship with the spouse who's left at home and who's now free is necessarily deteriorated, and sometimes it actually improves.
Because it's the fact that Lafayette no longer has to take on the role of a caregiver as well, so they can focus all the energy on being the spouse.
The wife or the husband again, they can be concerned about the well-being, they can tell the people in the care facility what they're doing wrong, but they don't have to execute on any of the difficult issues.
For sure. I think also talking about COVID, and like you mentioned now, Doctor, we had a few new residents recently, and it's been hard for the family members, that guilt kind of feeling, and the fact that we have COVID now and the visitations are so limited, so difficult, it was making it very difficult. And especially during the hard lockdown, when we didn't have any visitors, we could see the residents and the family members deteriorating in mental well-being because they couldn't see each other, and there was that guilt from the family side and wondering if everything is happening as it should be happening, and we could see the residents becoming lonely. So that was one of the very severe effects that we could see in our facility that was caused by lockdown and COVID and the pandemic.
And just introducing new platforms like Letitia said, like computers and Skype and Zoom, and it's just not the same. And those residents who become accustomed to it and get to know, okay, looking at a flat screen as opposed to the person, you still actually get some residents that want to look behind to see if the person's standing behind the computer because they just don't understand. But just trying all different ways of communication techniques just to get any form of reminiscence in, and identification and familiarity. Yeah.
I was impressed how our residents really adjusted well to the digital communication, but it was still a bit of a challenge. And like Melody said, trying to look behind the screen or trying to touch the screen.
It probably depends on the score of their disability.
Yes. Oh, that's very true. I think one of the questions was posed when the workshop was created was also how to engage your loved one at home in kind of activities, and that's always a difficult one. People talk about activities and you think it's actually a very global term. So I just thought we'll quickly touch on that. Okay. If you're living at home with your loved one, you are the primary caregiver, what can you do to engage them in a more productive way? So I think the first thing to remember is at home or in an institution is to think of the person that this person was before the onset of dementia. If this person never liked gardening and now you're trying to force them into potting plants and that kind of thing, they're going to hate every minute of it. So try to remember the background, the interest, the hobbies, the pastimes, and try to reflect that in your activities. Obviously also look at their level of functioning and what they're able to do, and then try to see if you can find something that's purposeful for them to do. So looking at the past habits, for example, if you had a gentleman who used to enjoy woodwork, you can do something as simple as giving him a piece of wood and some sandpaper and just telling him, I'm going to sit here and do my knitting, whatever, don't you understand this stuff? So that will bring back memories and skills he used to have, so that activities like that could help them to calm down and experience some reminiscence. In terms of a woman, maybe she used to enjoy kitchen activities. You can ask her to sort things in the kitchen for you, fold dish towels, or if it's possible, maybe just stirring some basic things, but trying to involve them in activities they used to enjoy. And then also, Melody, you mentioned this earlier, try to involve them in their daily care activities. Very often, especially in homes, I've seen that carers are in a hurry. Like Dr. said, it's 7 o'clock, shift over, turn over, we need to get this person involved. And they just do everything for the resident because it's easier. Frankly, I've seen this with my kids as well. I'm in a hurry. I'm not waiting for my 3-year-old to put on their shoes because I need to go, so then I just end up putting it on. And we should try to steer away from those things. So when you are involving your residents or your family or loved one in activities, try to engage them and let them do what they can. Even if it's just, I'm going to brush your teeth now, why don't you hold the toothbrush while I put the toothpaste on? That way they feel a bit empowered. Or you hold the face cloth while I put the soap on. And that way they're involved and they are focused on what you're doing. That might also make it easier for you to overcome difficulties like with bathing, if they feel they are involved. So something is not being done to them, they are together in this thing.
Yeah, it's all about enablement.
Exactly, empowerment and enablement is quite important. And often when we get residents, you will see they look as if they're on a certain level, and once you start doing this inclusion, all of a sudden their level of activity improves, because in the past they were just forced not to participate, and then it looked like they couldn't do it, but they actually were able to do those things. Also,
sorry, I'm interrupting. And also another point is it's extremely difficult for those out there that are caregivers to understand that this person that I once knew, especially if it's a family member, is no longer there. But it's also a way to embrace the new person that you're faced with. And so what a better way to get to know that person and then to get to know you. Because they will remember the young you, they'll remember the young you, but not the you that's in front of them now. So what a good way to bond by doing activities, getting to learn and know a bit about each other.
Yes.
Yeah.
That makes sense. Thanks for that. Yeah. Something I also always encourage is to narrate your activity. So if you're sitting with your loved one, instead of just getting up and going to get some coffee, tell them, honey, I'm running to the kitchen to get some coffee, I'm going to get you some tea as well. Or as you are going about your daily activities, just narrate and tell them what you're doing. Even though you don't think they're understanding or hearing you, but it's just a good way also to include them and to orientate them, to show them what you are doing, what's happening around them. So instead of just walking into the room and doing whatever you do, to say, hi, I'm here to change your clothes or whatever, so that they know what to expect also. We talk a lot about reminiscence, so that's bringing back memories from the past, and we always try to encourage reminiscence in all our interaction with our residents. So how you can do that is use techniques, try to trigger those memories from a long time ago. So objects that they were familiar with, music, movies, photographs, anything from the past, try to include them in your daily activities. If you make food, maybe think of something you ate together as a young couple and remind them and say, wow, remember when we were there, this is what we had. So try to always encourage them to use their long-term memory, and you might be surprised at what actually comes back to them. And then sometimes show reaction to things that you didn't even think of. Doctor, you look like you want to say something.
No, it's wonderful. I'm trying to remember all these things for one day when I get them.
And Doctor, we'll keep us a room in the villa for you, I told you.
And one thing I've noticed from photographs, having photographs in the room, is, anyone with dementia has good days and has bad days. So someone on a good day, if a family member, I can see the struggle when someone walks in the room and they'll go, hi mom, and mom goes, I don't know. But if you have a photograph in the room and you've got a picture of yourself as the 12-year-old little girl, and now you go, look mom, this is Sally, for example. Mom will identify and will tell you everything about Sally, even though you are, or Sally is a different age. So that's how photographs also work. So Mom actually does know who you are, but she's remembering you as a younger person, yes, and not who you are right now.
Oh, that makes a lot of sense. We've noticed that. So often it's good to bring out those old memories. Okay, music is something that we see which is quite popular. So our residents respond very well to music, even though they don't sing anymore or they can't dance properly, but we often see foot tapping and just smiling and emotions coming out. And usually also the older type of music. So it's very much fun to put on music and see them just enjoying the music. So use that at home as well. Put on music they would remember that they used to like, and see if you can encourage any kind of response from them.
That resident that I visited yesterday loved Fleetwood Mac. Do you remember Fleetwood Mac?
Yes.
Don't figure to Fleetwood Mac.
Yes. And also, when you have residents that can't hear very well, if the villa's got excellent acoustics, so you put the music on loud in the dining room and you rest their hands on the table where the music's playing, and they pick up on the vibrations and they will still dance even though they can't hear. They pick up on that. Yeah.
Did you see the question come through?
No, I didn't.
There's a question about how long it takes to recover from burnout.
That's a good question.
I
don't think it's like, the answer is like how long is a piece of string. It's a very dependable on the severity of the burnout, the cause of the burnout. I think also whether you are still in a situation, as long as you are in a situation and nothing has been done about it, the burnout is going to continue. So we need to look at
a break for certain.
Yes, and how can I break this and how quickly can I get out of this? I think that's a thing something to consider.
So my job, my profession is always to look at the worst case scenario and make sure we ring fence that a little bit. The problem with burnout is that not everybody recovers from burnout. Burnout can leave a scar, and that scar can stay with you forever. It doesn't mean that you don't reach happiness again or recover joy in life, but what it means is that your capacity,
your resilience,
your capacity is reduced permanently if you do not tend to burn out early enough or with enough enthusiasm and discipline. It's really, and that's what the big conflict is, and it's not only in situations of caregivers, it's in a lot of other situations. Because to turn around and turn away from your loved one in order to preserve your health is almost a contradiction. you have conflict around it, huge conflict. But remember, when you make that choice, if you don't make that choice in favor of relief of burnout, you may risk a long-term wound that will never heal. It's not to say that people don't carry on with life and have a reasonable life, but it does leave a scar if you do not attend to it. Yeah, you use the word resilience, which is a very popular word now. It's quite a nice word, actually. But you go forward in life with reduced resilience once you have recovered, if you do not attend to it. And of course, when you recognize it early and you attend to it and you take steps and you get help, like getting professional help with it, you can make a full recovery. But it's a very serious condition.
Yeah, people these days the word is thrown about burnout, and everybody thinks about burnout, but I don't think people realize that it is actually a very serious condition, and not just a state of stress that will go away. So the full-blown condition is really severe and can cause long-lasting effects.
It can give you neurological changes in your brain that are gone.
Yes, that's quite a.
It's unfortunately a very sobering way to look at it, and I don't want to terrify and frighten anybody, but life is like that. We all get old eventually, and our capacity shrinks.
But
Anyway, even if we never have burnout, so everything in life has got that edge to it that actually nothing, after a certain age, nothing improves and everything becomes smaller and more restricted. But we can help ourselves not to accelerate.
And I think, as you mentioned earlier on, the very important factor there is to stand up and say, I'm not okay. And it is not a shame. You should do that as soon as you realize that, because if you leave it too long, the consequences can be irreversible. October being Mental Health Awareness Month, I think people are making a point of raising awareness, but still there's a very big stigma around not being okay. And society's pressurize us to say we have to keep going, we have to be the best and the strongest and the fastest, and we can't cry, we can't break down. But that's nonsense. We need to be able to say, you know what, I need to take a step back, I'm not okay, I need help. Because that's a responsible thing to do. So I think we can probably close off if there's nothing else that you guys want to add about burnout. We can talk a lot about other things, but I think we are straying on the topic.
Do you have any more questions?
Thank you for listening, everybody.
I would just like to say, in summary, that it's very important that we at Nazareth Care focus on quality of life. So quality of life for us is also looking at physical and social and mental well-being as well. We focus on enablement and not disabling people. We focus on person-centered care. We focus on person-centered care plans. Like we mentioned earlier, we work in the resident's home. It's not the other way around. So it starts with trust, like our core values, and mutual respect, and absolutely understanding that they have a right as well. So that all encompasses quality of life. And how we tackle that is actually through helping with medication, trying to get people off as much medication that they don't need as possible, so that we can work with the person and not with the medication, and then bring in meaningful activity, bring in occupational therapy, and just help them get that meaning of life back. So even though we know that their dementia is a poor prognosis, we can make living with dementia and quality of life much more prosperous for the person, and that's what we strive for.
You must remember, we're not dealing with a disease, we're dealing with a person, so look beyond the disease.
Yes. So, and for anyone out there, if you have any questions or you need any support, you're welcome to contact us at Nazareth Care. I think our email address is connect@nazarethcare.co.za, and we'll be able to help you with any queries or questions that you have from this workshop.
Also, I'm sure on the Facebook page, you can use the Facebook page to connect with us. And we just launched our brand new website, which you can go and look at, and you'll find all our details on there as well, and any more information you need. Dr. Goodman, if they want to get hold of you?
Yeah.
Doctor is busy now. Dr. Wills, just want to say thank you for your involvement.
Thank you very much.
Dr. Goodman is always there when we need him, and this is wonderful to our residents. And yeah, thank you for listening. It was our first webinar. We'll online support. We'll have another one next month. Look out for the details.